Hello, welcome back to the Medicare Team podcast. Today we'll be talking about some of our craziest Medicare stories and how some of these, mistakes cost people thousands. So my name is Sean Heffron, licensed insurance agent, and I am joined today by
My name is Thomas Fulmer. I'm also a licensed insurance agent with the Medicare team.
and yeah, today we'll just kind of be going over some of our craziest stories, some, mistakes that we've seen that end up costing people quite a lot. So TJ, I think you had a pretty crazy story
Yeah.
from last week, right?
Yeah, last week I was talking to a woman and she was on an HMO, right? So for those who don't know, HMOs, you do have to stay in network with your doctors. You have to make sure that your hospitals are in network, any, doctor that you go to. And she called about looking for a different plan because her hospital wasn't in network. So I guess what happened was something happened to her. I'm not sure what it was, but she ended up going to a hospital that was not in network with the plan that she currently was on.
Oh my gosh.
And I'm pretty sure whatever procedure that she had done cost her thousands. So that's just one thing that you have to make sure is that your doctors and the hospitals that you go to, around your place, wherever you live, are in network, especially with HMOs, because they will turn you away. And if they don't turn you away, then, you're going to pay the out of network rate. So, it's really, really important to make sure that they're in network.
Yeah. And that's something we see a lot, especially with, talking to people every day is the difference between that HMO and PPO, where like you said, with an HMO, obviously you are a little more limited as to, who you can go see. And yeah, a lot of times with these plans, you'll see set copays for most of the in-network costs with HMOs. Whereas for out of network, you'll see, like TJ was saying, 50% co-insurance or 20%, 30%, whatever it may be. But,
Right.
50% of the cost of the bill is going to be a lot more than just a flat copay. So it is definitely important to make sure that, one, your doctors are in network or the hospitals or clinics that you go to are in network. And then to piggyback off that, the medications are also just as important.
Yeah. Yeah, no, for sure. Yeah, I mean, do you have any stories where like a client based solely they wanted maybe a food card, a give back, they weren't really taking into consideration,
The other
benefits
Yeah.
like, the copays and stuff if they were to go to the hospital or, whatever else. They really just were focusing on, the out of pocket or not out of pocket, the money back in their pocket every month.
Mhm. Yeah, funny enough, I actually do. Again, last week on Friday, I talked to a gentleman who, he was relatively new to Medicare, didn't really have a plan in place just quite yet. So, we were taking a look at some options for him, kind of, just ask him what he needs, how he plans to kind of use the health insurance moving forward. And we actually talked about two options. One of the give back options, which again, just, gives you some money back each month. It's basically a reimbursement on that Part B premium that you pay. We kind of talked about that give back and, he loved the idea of getting, $130 back each month. What he didn't like was, the dental coverage. So we kind of talked back and forth and, initially he told me that he needed dentures and that was a big procedure that he needed done this year. So we took a look at two different plans, one with the give back that didn't have denture coverage and one without the give back that did have denture coverage. Of course, he chose the give back, not realizing how much he would have to pay for those dentures.
Yeah.
And actually, thankfully, he gave me a call back and said, you
Good.
know what? I tried to get the dentures done. I saw how much they were going to be. So is there any way we could switch me over to the other plan? And luckily, we had enrolled him when his new plan hadn't taken effect yet. So we were able to actually get him back on the line, call him, go over the same things, and then actually switch him over to that plan that covered his dentures entirely.
Good.
So that's an exact example where, it is nice to get that money back every single month. And it's something that you can, see. It's tangible. You get to use it every single month. But you may not be considering, hey, in 6 months, I have this, dental procedure
Exactly.
that's going to be thousands. So
Yeah.
is it worth it to get a couple $100s back each month or, not have to pay $1,000 for dental or hearing, what it may be?
Right. Yeah, no, and that's, just piggybacking off of that. I mean, $130 a month is good, right? It's good to have that money back into your Social Security. But, like you said, the denture coverage wasn't there. He would have had to pay, I know dentures typically are around, $3,000, I think, on average.
Mhm.
So that kind of just defeats the purpose if you had to pay out of pocket for those. But I'm glad that you got him back on the line there. That's awesome.
Yeah, it was really great that we were able to help him and, actually get him the plan that was best fitted for him. And with that, like you said, it is great to have that $130 back or whatever
Yeah.
that give back may be. It's awesome to have that money right away. Sometimes not considering what costs you may have in the future.
Yeah.
So it's definitely tough, and that's kind of the reason that you want to talk to an agent rather than just kind of look yourself.
Right. That's
We
gonna
see these numbers every single day. We know exactly, the red flags to look out for. And after just talking to, individuals, we know whether or not a give back would be beneficial.
Right.
So
And that kind of leads me into my next point that I wanted to talk about today was, why one size fits all isn't, kind of the way to go when it
mm,
comes to Medicare.
it's a great way to put it.
Because everybody is different. Everybody has different needs,
Mhm.
right? So a supplement plan is going to be the best option for one person, to whereas an advantage plan is going to be best for another person. And even, if just strictly with advantage plans, right? Like one advantage plan could cover this, whoever it is, completely, to whereas they would have to pay thousands. It just really depends on anybody else. You really want to make sure that's why the professional guidance does matter, right? That's why why we do what we do. We're here to help you guys. And we really just want to make sure that I know Medicare is confusing. I know that there's a lot of moving parts in Medicare. So we really kind of just want to ease that pain. We really, really want to make sure you guys understand, the differences between Medicare Advantage, Medicare Supplement, understand everything that's going on within your plan so that there's no, surprise payments you guys have to make, no surprise bills. So yeah.
Yeah, and to touch back on the why one size doesn't fit all,
Yeah.
it's funny, a lot of the times we'll talk to, married couples and, you
Right.
talk to a husband, then end up helping out the wife. And
Mhm.
a lot of the times what I'll see is that they end up being on the exact same plan.
Yep. Every time.
And it's funny because, like you said, they're two completely separate individuals.
Right.
Maybe the husband has a perfect medical history, very healthy, but the wife, on the other hand, has some issues, some chronic conditions. And, in that situation, it doesn't always necessarily make sense to be on the same plan.
Yeah.
Even if, your husband's had received great coverage with Humana, and now the wife's like, oh, well, my husband has Humana. It's been great. He doesn't really have to pay a lot. I'll also get on Humana,
Yep.
even though there may be some other options that cover her medical needs, much more efficiently and more
Exactly.
comprehensive than the husband's. So
Yeah.
it is really tough. Again, to what you said, that is why it's important to kind of reach out to us. We do care about, helping you, asking you the questions, trying to find a plan that actually is tailored for you and is going to cover you the best way.
Yeah, definitely. I do have another story
Mhm.
regarding that. I forget when this was, but it was a husband and a wife that called in, wanting to look at some of the benefits, some of the options in their area. So I was taking a look, started with the husband, found him a plan that would cover him very well. It was very, very suited to his needs. So we got him all set up. The wife then wanted to take a look. She actually automatically assumed, like you said, she said, can I, get hooked up with the same one? And I
Yep.
said, hold on, we need to make sure your doctors and meds are covered because they do see different doctors. They take different medications.
Mhm.
So went through her whole thing, and I ended up just actually telling her she was good where she was at. I would have loved to help her out. I wish there was something in her area that would have offered her coverage that benefited her. There just wasn't anything for her, and that's what we'll always do, right? We never want to just, put anybody in anything for no reason. It just wouldn't have made sense for her specifically, to whereas it did with her husband. So that's a story there about, talking about
Yeah.
making sure.
And that's a great example where, sometimes unfortunately there just isn't anything better.
Yeah.
Which is unfortunate, but it's also great because then you know that you are on the most comprehensive option.
And
for
you're
you.
right.
And it's unfortunate that you couldn't help her, but at least you knew that where she was at made the most sense for her with that
Right.
plan. She didn't have to change
Exactly.
anything.
Exactly.
And funny enough, then I wanted to bring up a story that I had where, an individual had Medicare and Medicaid. So I know, Medicare alone is very confusing. Then when you add the whole Medicaid
Oh, yeah.
situation in there, it's definitely
Right.
very confusing. Basically, in short, she had a partial level of Medicaid,
partial
which means, it'll pay for some things. It won't pay for every single service that she'll have done. And she must have talked to an agent where they just saw that she had Medicaid. They didn't verify the exact level of Medicaid. And they put her in what's known as a dual eligible special needs plan, which is obviously plans that you
Yeah.
need to have a Medicaid level to be on. And it is difficult because with those plans, there's so many different factors and things that go into it. So the agent that she spoke to must have put her in a plan that just really didn't make sense.
Right.
It was great because she was getting a couple $100 on a food card every month, which is great. It had, really high copays for certain things like inpatient and
Right.
outpatient. And I just don't think that agent was considering, hey, yes, you get all this money back each month, but God forbid you have to go even one night in the hospital. It's a $2,000 copay just for one
Right.
night.
Just for one night.
And that's just some of the things where it is important to not only talk to an agent, but find the right agent that actually cares for you and
Yeah.
wants to find you the best plan, because we would never want to put her in a plan like that. Obviously, it's great to have the money back each month, but we leave her so vulnerable to, ridiculous hospital costs. So
Right.
it's all about finding that balance of, where they should be at and what's going to help them the most.
Yeah, definitely. I mean, and these are all examples of things that are, small mistakes that you could easily forget. People think that just because, like you said, I have Medicaid, there's a difference between full and partial Medicaid. A little slip up like that could cost you $2,000 down the line if you're not careful. And also, what I touched on earlier with the doctors being out of network. Another small mistake, didn't verify your doctor was in network or your hospital, and then you end up having to pay thousands of dollars.
Hmm.
So, I mean, it really, really, you just really need to be careful with everything, right? You need to verify everything. You just need to make sure everything is set up the way that it should be. And that's kind of, where we come in again. That's what we do every day. We've been doing it for a long time. So we would love to help you out for sure.
Yeah, absolutely, and absolutely, and again, just to touch on that, like, it is very important to not only talk to an agent but find that right agent. I
Yeah,
know, it seems like this is something that everybody could just do themselves, which obviously you could, but the nice thing about having that professional guidance is we look at these numbers every day. We know what to look out for. We know how to verify and make sure your doctors are in network, make sure the medications are covered. Every single thing that goes into it. That is why we do what we do, to make sure that these people are getting the coverage that they need. Also, everything lines up so that they're not going
right.
to go, talk to their doctor and their doctor's like, oh, well, I see you switched to Aetna. Unfortunately, we don't take Aetna. Now
Right.
they're out of a doctor. Maybe they need a procedure. Who knows how long? So it is very important to, like you said, make sure all that lines up. And that's where we come in, being the professionals, being, with the Medicare team, we make sure that everything is lined up. Doctors are in network, medications are covered, and, making sure they're covered in the best way
Yeah,
possible.
for sure. Is there anything that, like, maybe months or even years down the line where you've talked to a client that they, come back and regret?
Yeah, I think similar to what we touched on earlier with the give back,
Yeah.
I think initially a lot of people love the idea of a give back. Obviously, I mean, it's extra
Yeah.
money each month. Who's not
Hmm.
going to love that? Especially when you're 65, you're normally not working anymore. You're on more of a fixed income. Obviously, increasing that income is going to be lovely for anybody. The problem comes where, the give backs, since they do give you a ton of money back, they do tend to have slightly lesser coverage with higher copays. So if you're a healthy individual that never goes to see a doctor, you don't take any medications, well, give back might be a amazing option for you.
Right. Exactly.
But if you're someone, like I said earlier, with, a couple chronic conditions, you take a longer list of medications, you have a couple specialist doctors that you see a couple
Yeah.
times a month, then it doesn't make sense for a give back. And that's, what we see a lot is people call back in, they were on a give back, and they're like, hey, I've went to the hospital and now I have these very high hospital bills that I just can't pay
Right.
despite having to give back. So,
Yeah.
in that situation, it would have made more sense for you to get on a more comprehensive option that necessarily doesn't give you the money back, but later down the line, then
Covers
you
you a
don't
lot
have to
better.
worry about all those costs.
Yeah, for sure, for sure. Another thing that I wanted to talk about today was medications. Not really into the tiers or whatever, but I like medication coverage is important
Hmm.
because, that's another one of these things that you have to verify, which we can do here on our end that can save you, possibly thousands of
Thousands.
dollars. Yeah,
Yeah,
exactly.
absolutely.
So just making sure that your medications are covered because just because one, for example, Humana plan covers all of your medications doesn't mean that the another Humana plan, even though it is still with Humana, doesn't mean that they're all covered the same exact way. And we've seen this a lot, people calling in saying, I just switched for, in AEP now come January and I'm paying $300 for my drugs. So, that's one of the big things as well, doctors in network, drugs covered, stuff like that, that really, really needs to be considered.
Yeah.
So,
And again, that kind of draws back to the why speaking to a professional
yeah,
is very important, because like Thomas was saying, just because you are with Humana or United Health and maybe that plan that you're in accepts all your doctors doesn't mean that the other United or other Humana plan will accept the doctors. So
right.
that's where like you were saying, Medicare is very confusing because you
Right.
would think if it's Humana, oh, of course they're in network with Humana.
Yep.
Well, that's not necessarily how it works. They have to be in network with that specific Humana plan.
Yeah.
So that's where, again, talking to the professionals is the most important thing, just because we can verify that on our end.
Yeah.
And it does save people thousands
It
being
does.
in network versus out of network.
It
And to
does.
touch on what you said about the medications might be the most costly thing
Yeah.
sometimes, especially if you see maybe Humana doesn't cover a medication. When it's
Mhm.
not covered, the costs are outrageous. I mean,
They're
I've seen,
ridiculous. Yeah.
sometimes when you see a plan that doesn't cover any of the medications, you'll see 50 to 100,000
Yeah.
annually cost, and you're like, hold
Yep.
on.
This isn't
This
right.
is crazy. You're paying
Yeah.
100,000 for your medication. I mean, that
Right.
shouldn't happen. But again, that is why it's important to reach out to us, get that quote, just, talk to us and see which plans would cover them, which would not. Just see which ones are even an option for you. You know what I mean?
Yeah.
We're never going to consider an option that doesn't cover your medications, has your
No.
doctors out of network. Even if it did give you a lot of money back a month, it's just not something we would recommend because of
No.
all the later on problems that you'll have.
Yeah,
So,
of course. I mean, and I've talked to many people to where they have switched just because the medications were covered.
mm,
That's how, dire that is to make sure, or how dire it is to make sure that they are covered,
mhm.
because people end up paying, $300-400 every single month. And it's just, that it could be the best plan in the entire world, but one medication's not covered, and
Mhm.
then they're paying, they're losing more than they're gaining.
Yep.
So, that is really important to make sure that they're all covered.
And it's unfortunate because with medications, a lot of the time it's medication that these people need. Do you know
Yeah.
what I mean? We're rarely just taking medication just for the fun of it. It's
Yeah.
always, important.
Yeah.
It's something you need sometimes just to function daily. And
Mhm.
so, to be switched to a plan where it doesn't cover that medication and now you have to pay, like you said, $300, $400,
Yeah.
it's just a shame.
It
You
really
may
is.
have gotten money back, but now if your medication's not covered, that's one of the most important things in your daily life. So,
Yeah.
making sure that that medication is covered is very, very important.
Yeah. And then another thing that I wanted to talk about or another story I wanted to tell, was a lady that was on a supplement that also, I'm pretty sure she had Medicaid. So she had full Medicaid and was on a supplement plan, right? So for those who don't know, if you're on full Medicaid, you pretty much have all of your medical bills being paid for. Your copays, coinsurance, premiums, deductibles. Also, you probably have low income subsidy, which helps pay for your drugs. So this lady already had all of that coverage through Medicaid. And she was also paying $300 a month to be on a supplement plan.
Which pretty much does the same thing as
Does
her
the same thing
Medicaid
as the
level is
Medicaid
doing,
does.
yeah.
Exactly. It covers, all the gaps or the supplement plan covers all the gaps that parts A and B don't cover, but she already has that coverage because of her Medicaid.
Mm,
So essentially, she's paying $300 a month towards nothing.
mhm.
Right. And this is kind of, Medicare is so confusing, which is why, we're here. But if she would have just, had guidance about what it was what she had for the Medicaid and what she was paying for and what that covered, she could have saved, I'm not sure how long she was on that before she,
Mhm.
called me, but if she had years ago, or, I hope she didn't have this for a long time, but she was paying, $300 a month
Wow.
for the supplement plan, which wasn't doing anything for her.
And just a small change like that of just her calling in, talking to you, you
And
seeing that and realizing it, now you've saved her $300 a month.
Yep.
And she has the exact same coverage.
Yeah.
Nothing's changed. She just doesn't have to pay for something that
Right.
isn't technically helping
she
her at
actually
all.
she gained because,
Mhm.
going from a supplement, it doesn't include the ancillary benefits, right?
Mm,
Like the dental vision, hearing. It doesn't include drug coverage. She also had I didn't even mention this, but she had a additional prescription drug plan, I
mm.
think, which was another $50-60 a month.
Wow.
So to whereas these Advantage plans do. So we got her hooked up with an Advantage plan. I think she got around $200 for food every month. She got, I think, $3,500 every year for dental, $0 copays for her hearing aids, if she needed dentures, stuff like that. So
Wow. So not only is she not paying the $300 for the supplement, she's also not paying for the
Right.
prescription drug plan, and she's getting extra money back each
Exactly.
month. So saved
Exactly.
her definitely a lot of money.
Yeah, a lot of
And
money
it's
there.
just small things like that too, of just, even if you're not necessarily considering changing your plan, or maybe you don't think anything's wrong, just a quick call just to make sure. It never
Yeah.
hurts. We love to just take a look, even if there's nothing out there that's better.
Yeah.
At least we can give you the comfort of, hey, this is the best spot for you right now.
Right.
This makes the most sense.
Exactly.
And just a small call like that, she ended up saving hundreds of dollars each month.
Exactly.
That's
Yeah.
awesome.
Yeah.
And I think one of my other stories that I definitely want to talk about is, I've talked to a lot of people that stay with carriers just because they've been with them for so
Yeah.
long. And, you talk to a lot of people that, oh my gosh, I love Aetna. My sister's been on Aetna, my brother's been on Aetna, I've been on Aetna for years, and it's amazing. And, a couple episodes ago, we had talked about why it's so important to do that annual checkup. And this
Yeah.
kind of touches back on that is, you may love Aetna, you may love Humana, but that doesn't necessarily mean that there aren't other carriers that provide, equal or even additional benefits.
Right.
And just doing that, yearly checkup could save you thousands.
Yeah.
And the tough thing with Medicare too is why it's so confusing is every year things change. We talked about all the changes in 2026, and that's just this year alone.
Yeah.
You have all the years before that, the years coming up. There's so many things that change every year that
Yeah.
it is important to make sure your doctors are still accepted, no medication coverage has changed at all, and just to explore other options, just see what's out there and what other benefits you could be getting.
Yeah, for sure. I mean, it costs nothing to call, right? If nothing else, calling in, verifying that, like you said, even if you are on the best plan, okay, at least you called, you checked,
Yep.
now you know.
Now you have that
Um,
comfortability is, you
right.
know what? There's nothing better out there for me. I feel comfortable.
Good where I'm at.
Yep.
Right, exactly. And, best case scenario is there's something better out there for you, right? And then we
Mhm.
can definitely help you out in that way as well. But there's no risk to calling. We're all, we all want to help you here. We have no issue. This is our job. We love doing it. And we love helping people out, especially because we know, we both have grandmothers, grandfathers that are on Medicare. So, really behind the scenes, getting to see how all of this works and understanding it and being able to convey that information to seniors, really, really makes me feel good. I'm sure you feel the same. So, definitely book an appointment if you haven't yet. If you guys have any questions, just reach out. We're more than happy to talk to you guys.
Yeah, and whether or not you're a new client or an existing client, always feel free to call, no
Yeah.
matter what. If you're an existing client and we've helped you out and you just want to take a look at, certain things, you just want to understand a certain copay or how, this procedure works, just call. Like Thomas said, it's a free call. It doesn't hurt to call. And like that lady that you were talking about with Medicaid, I mean, she called and ended up saving hundreds of dollars a month
Imagine she didn't call.
and got money back each month. So
She'd still be paying if she
she
didn't
would
call.
still be paying. Yeah,
Right.
she would have ridiculous costs. Like you were saying, just a quick call just to see, even if you think you're on the best option, even if you've just switched and you just want to take a double look, just make sure.
Yeah.
It just never hurts to call.
Never
And
does.
always make sure you get the coverage that you need.
Yeah, for sure. I think we're about wrapped up here with this episode,
I
but
think so.
yeah, it was nice being here. I love talking to you.
Mhm.
I love working beside you. For anybody, like we said, if you haven't reached out, you have any questions, please, please, please feel free to reach out to us here at the Medicare team. We have a lovely group of people here that all want to help you. We have no issue doing it at all. Even if you just have one question, you think it's a stupid question, please reach out. We'd love to help you guys.
Yeah. And I just want to say before we wrap up here, thank you to all of our valued clients. Like I said, whether you're new or existing, please always feel free to contact us. And you can also schedule a free consultation at medicareteam.com/free.
Yeah. Alrighty.
All right.
All right. It's been a pleasure.
Been a pleasure. Have a great one. Thank you for tuning in to the Medicare Team podcast, and we'll see you next time.